Cerebral palsy is a neurological disorder that is developed in infancy or early childhood. Common symptoms include lack of muscle strength and control and involuntary movements.
Oftentimes, their muscles can be very stiff, making it difficult to do things or walk. People with CP may also experience seizures and develop hearing or vision issues.
This is because the part of the brain that is affected by cerebral palsy is the same part that controls motor functions.
Spina bifida is the #1 birth defect that permanently disables Americans.
It is a birth defect that occurs within the first 28 days of pregnancy when the brain and spinal cord do not connect properly.
Spina bifida is caused by genetic and environmental factors.
There is an incomplete closing with backbone in infants with spina bifida, and from that point down, they are paralyzed or have leg weakness.
People with SB are also likely to experience pressure sores or bladder issues.
70% of people with spina bifida are allergic to latex, and 60% of children are diagnosed with a learning disability due to a high likelihood of neurological issues. While cerebral palsy affects each individual differently, although the brain injury that causes cerebral palsy cannot be healed, the physical disabilities that result from the injury can be managed through different types of treatments and therapies. The primary treatment for cerebral palsy includes therapy and adaptive equipment. Some individuals also need drug therapy, surgical interventions, or complementary and alternative medicine for extra assistance.
The primary treatment goals for patients with cerebral palsy include
optimizing mobility, managing primary conditions,
controlling pain,
preventing and managing complications,
maximizing independence,
enhancing social and peer interactions,
fostering self-care,
optimizing ability to communicate,
providing quality of life,
and maximizing learning potential. The treatment for spina bifida also depends on the severity of the condition. Spina bifida can involve surgery to put the meninges back in place and to close the opening in the vertebrae.
Performing the surgery early can help minimize the risk of infection and may also help protect the spinal cord from additional trauma.
It takes place before the 26th week of pregnancy. A pregnant woman's uterus is exposed surgically and open to repair the baby's spinal cord.
Most times, children who receive the fetal surgery need fewer shunts and are less likely to need crutches or other walking devices.
However, the operation possesses risks to the mother and greatly increases the risk of a premature delivery.
Opportunities for those living with them.
Although these exceptionalities may impair these people's lives, many of them just learn to do things differently than others and are able to continue living a healthy lifestyle. One organization that strives to do everything they can for people with cerebral palsy is the International Cerebral Palsy Society. It's an international organization that was founded in the UK in 1969. It was created to help increase acceptance with people with cerebral palsy and to diminish the idea that they should not be accepted socially.
Unfortunately, in some parts of the world, cerebral palsy is actually considered a punishment or curse brought upon a family or individual.
Another important organization is the Cerebral Palsy International Research Foundation. It is a nonprofit organization based in Princeton Junction, New Jersey.
They raise money to fund research and help initiative educational processes for people with cerebral palsy.
Another society that is very important to the community of people dealing with cerebral palsy is My Child. This organization provides information and inspiration for children with cerebral palsy, along with their caregivers and families.
The My Child Facebook page also offers parents of children with cerebral palsy and adults living with the condition a place to connect, share, and to be inspired. Now over to Gabe with the sports.
There are several opportunities for people that use wheelchairs to get involved in sports. One of the most popular sports adapted to wheelchair users is basketball. The official Wheelchair Sport Foundation organizes teams and competitions that are extremely popular all over the world. Adapted sports include football, fencing, baseball, hunting, among many others. Their motto is that if a sport exists, it can be adapted. March is Cerebral Palsy Awareness Month, and October is Spinal Bifida Awareness Month. The Spinal Bifida Association of Alabama is an organization that assists Alabama families that are affected by the disease. They fund medical equipment, provide family connection programs, new parent education programs, awareness events, and annual Christmas parties, and a fun educational weekend family camp. Thank you.
Thanks for watching.
Thank you.
Hey.
Let's get that A.